Hi. Today we shall discuss about colorectal cancers. By colorectal cancers we mean cancers of the large intestine. So the rectum is the last part of the large intestine, and the large intestine is again divided into cecum, ascending colon, transverse colon, descending colon and sigmoid colon. So this constitutes large intestine or colorectum. So it's one of the important sites where one can develop cancer, and if you see the incidence of colorectal cancer, it is increasing in India too. In Western world the incidence is much more than what we see in India. In India the incidence is lesser because of the food habits and various other reasons, but unfortunately with we mimicking the Western lifestyle and having less fiber in the diet is increasing incidence of colorectal cancer we are also seeing in India. So coming to the etiological factors or the causative factors for colorectal cancer, we cannot pinpoint a single causative factor. Age is by far the most important risk factor for developing colorectal cancer, and of course other risk factors like smoking and decreased fiber in the food, increased red meat consumption, these are all the risk factors for development of colorectal cancer. And it can affect men and women, and usually we see after the age group of 50, and also we do see in younger age groups if it is a hereditary cancer syndrome. So when to suspect colorectal cancer? If someone has a new onset of bowel disturbance, say alternating constipation or diarrhea, abdomen upset, stomach upset, in a new onset of symptom after the age of 40 years, it should not be neglected. Or if somebody is passing blood in the stools, it should not be neglected. So any constipation or diarrhea or change in the bowel habits after the age of 40 years or passing blood in the stools should warrant consultation from the doctor, and it should be investigated thoroughly. And the importance of colorectal cancer is it is amenable for screening. It can be detected before the development of cancer, and it can be completely cured if it is detected early. So generally a screening test called colonoscopy is recommended for all individuals after the age of 50 years. And if one colonoscope is normal, we can repeat once in 10 years. Because the development of cancer is a slow process, it grows from polyp to adenoma to carcinoma. So it takes 3 to 5 years for this sequence to develop. So if a person is detected in adenoma stage and if it is addressed, he may not go into the stage of development of carcinoma. So one colonoscopy after the age of 50 years for both men and women is recommended. But unfortunately because of the sheer population and lack of infrastructure, we are not able to implement this in India. But of course if anybody is interested, they should undergo colonoscope after the age of 50 years. And we have discussed the symptoms of colon cancer and how to detect it early. So once we diagnose, the diagnosis is usually by a colonoscope and biopsy. So once we diagnose, we have to decide the stage of cancer. As in any other cancer, we have 1, 2, 3 and 4 stages in colon cancer and rectal cancer, and according to the stage the treatment is decided. By and large the colorectal cancers, colon cancers especially, are detected in stage 1 and 2 or 3 and are amenable for cure in more than 50% of the situations. And the most important treatment if it is detected in stage 1 to 3 is surgery, and that part of the colon is removed, and then further treatment is based on the pathology report, whether the nodes are positive or negative, and various other risk factors. If they are involved, chemotherapy would be required. Whereas rectal cancer is almost dealt in a similar lines, but there are some changes in the treatment modalities, like radiotherapy is required in most of the patients of rectal cancer after the stage 3, and then the cure rates are little lesser in rectal cancer compared to colon cancer. So colon cancer can be detected early, it is amenable for screening, and any new onset of symptom after the age of 40 years, altered bowel habits should be brought into notice, and it can be detected early, and most of the colorectal cancers are amenable for cure, and it is possible to detect them in early stage, and if treated appropriately, more than 50% of colorectal cancers are curable.